Well, anytime we get a few minutes with a cardiologist, we're going to ask all the hard questions. We've got Dr. Christopher Reed here. We're at the Millennium campus of Bon Secours. So thank you. I know you're super busy, but I wanted to talk today about AFib.
Yes.
What exactly? We always hear those, words. What exactly does that mean? What does it stand for? And how can someone tell if maybe they have that?
Yeah, no, that's a great question. And AFib, or atrial fibrillation, is the full phrase there. It's the most common abnormal heart rhythm that we see in cardiology. It affects many, many people, and luckily it is something that we can treat and we can help diagnose. There's been a lot of advancements recently. What people can look for if they feel they may have AFib, oftentimes a symptom of underlying fatigue, maybe feeling like the wind is out of their sails. Sometimes they will get palpitations, and even a little less commonly, they can even get chest pain or lightheadedness, dizziness with this. And that usually prompts them to see somebody, either their primary care physician, the emergency department, or their local cardiologist if they're already established.
Now, would this be why they're doing something physical or just in their normal everyday life?
Great question. Both are true. Oftentimes something like an overt exertion, a lot of stress in their life, perhaps during athletics. This can be drummed up, in particular with our recent history with the COVID pandemic. Inflammatory responses such as a really bad flu or infection can also cause this to come about.
And how does that work? Let's say, okay, I've noticed I'm feeling more out of breath or something. Do you go to your normal doctor first and then they send you to someone that you, or am I like, I got Dr. Reed's number, I'm giving him a quick call, I don't want to mess around?
Both are great. I think in this day and age, I really encourage patients, once they're of the adult age, to establish with a primary care doctor. I think that really helps expedite diagnosis and treatment. But usually, even in this day and age, it's also wearables. People have iWatches or a Garmin, or they even grab their spouses or their partner's iWatch and they slap that on, and it may say, you have atrial fibrillation. I think to get in quickest would be a primary care doctor or an emergency department visit.
Okay, and let's say you are, I guess, are you diagnosed with AFib? Is that the correct?
Yes.
Okay, so let's say you're diagnosed with AFib, then what happens?
Yeah, so there's two main pillars that I always start with atrial fibrillation. In and of itself, it is not a life-threatening heart rhythm. It can cause severe symptoms, and it can give you anxiety and the symptoms we discussed earlier. But we really want to prevent stroke, and we want to try to keep you in normal rhythm, or more importantly, get you out of atrial fib.
Okay.
So there's a number of things that your doctor will discuss with you about whether or not you need a blood thinner for atrial fib. And then additionally, there's multiple tools we can utilize to get people back in normal rhythm from atrial fib. The discussion in the emergency department and with a cardiologist is what helps progress that discussion to get patients the care they need.
Well, Bon Secours, y'all have just kind of celebrated the opening of a new space. Tell me about that and how that's going to benefit our viewers and patients.
Yeah, no, we have two brand new electrophysiology labs. That is where we do procedures. And we alluded earlier to the newer technologies that have been developed. So we perform both radio frequency, which is heat ablation, as well as a newer technology called pulse field ablation, which has in particular really improved the safety and efficacy of ablation. That's the most involved care we give to keep people in regular rhythm, but it's also one of our best tools we have. And so over the last 3 to 5 years, we've really been able to access more patients, get better care, and more efficacious care so they can get back on their feet and feeling better.
You see why we let you say all the big fancy words? We love it so much. Before we let you go, is there anything that people can do to prevent even getting AFib, or is this just something that just kind of happens?
Absolutely. There's always lifestyle that we want to treat first before we get to medications. So eating a healthy diet, vegetarian focused, you can absolutely eat proteins, but vegetable focused is great. Exercise, always remember that movement is medicine. Weight control. We always look to make sure that we're not taking too much caffeine. Coffee is fine. We used to think it was more involved than it is now. And then a big thing that we also help our patients with is checking their thyroid, as well as if they have sleep apnea. So wanting to make sure that if you've got undiagnosed reason for snoring, that we get that taken care of, as well as just getting general good care from your primary care doctor.
See, such great information. We're going to let you get back and work on all the important things you're doing. Thank you so much.
Absolutely.
We're doing all the information at the bottom of the screen, bonsecours.com. Thank you.
Thank you.